My name is James Kang, and I'm the chairman of the Department of Orthopaedic Surgery here at the Brigham and Women's Hospital.
I get to do a lot of primary joint replacements where patients specifically go home on the day of surgery, which has been a big focus of mine.
My particular focus in sports medicine is complex knee surgery and cartilage repair.
The sports department at Brigham is a very small, close-knit group, and it's really like a small family. Every one of the faculty are very invested in my education. They're always happy to have me come to their ORs, even if I'm not assigned to them for that specific day. And so, I think long-term, I'm forming mentors that I'll have for the rest of my life.
As a hip and knee surgeon, I love everything about the hip and knee when it comes to replacing them. Primary, complex primary, revision procedures, as well as robotics.
Hand surgery is a pretty diverse field, so I like doing a diverse practice. I particularly enjoy treating patients with Dupuytren's contracture, and I really enjoy treating people with complicated distal radius fractures as well.
I take care of patients with a variety of problems, ranging from degenerative problems to trauma, to deformity, to sports medicine stuff, and some diabetic-related care also.
So the Brigham program was recommended to me by one of my attendings in residency as being a very strong fellowship program with good revision experience, great operative experience, and just all around a really great program.
I have a fairly comprehensive sports medicine practice. I take care of a lot of shoulder and knee problems and some elbow, a lot of my young athletes, middle-aged athletes, and even master athletes.
Most of my practice is orthopedic trauma, so fracture care, but I have a specific interest in periprosthetic fractures and pelvic fractures.
All the faculty within our division enjoy treating every single component of foot and ankle and every single disorder within foot and ankle surgery.
So the Spine Surgery Fellowship is a dual program where you spend part of the year at the Brigham and part of the year at MGH. It's been wonderful. You get a much broader range of pathology and ways to treat and how different surgeons address different pathologies.
As the chair of the department, say with great enthusiasm that the Brigham and Women's Hospital is on a tipping point of emerging into a great period.
The mission of the fellowship program is really just to provide the best educational hand surgery experience we can.
Our goal with our orthopedic trauma fellowship is to really create excellent practicing orthopedic trauma surgeons. But also we have a mission to create educators and researchers within orthopedics.
The best part of the program is the relationship that you get to develop with the attendings.
The mission of our fellowship program really is to train the sports medicine surgeons of the future. I do want to see our fellows leave our program competent both in shoulder and knee surgery as well as in hip and somewhat foot and ankle surgery.
The goal of us as fellowship trainers is to provide our trainees with 1 year of focused training on joint replacements, complex revisions, but my favorite part of fellowship is the first year to 5 years where I continue to get messages from fellows asking opinions about cases.
The mission of our foot and ankle program is to provide our trainees, our fellows specifically, with a broad spectrum of foot and ankle pathology, such that they'll get exposure to a huge variety of foot and ankle problems.
What I've appreciated most about being at the Brigham is the people. It's such a positive culture here. Everybody's invested in my education. It's a great positive group of people to work with.
Within orthopedic trauma in particular, we have a broad range of practice. So our fellows get exposed to everything from clavicle and proximal humerus fractures to periarticular fracture dislocations of the elbow and wrist.
Our fellows get experience in trauma, in reconstructive operations, in rheumatoid arthritis, and so there is an enormous amount of breadth and depth to this fellowship experience.
The fellowship program here is unparalleled. We have a huge variety of attendings here so they can get a really rich experience with regards to clinical backgrounds.
We are a young, dynamic, fresh team with very diverse ideas. None of us comes from the same training background, so they really have the ability to learn different ways to do the same surgery.
It is enormously rewarding for me to work with the fellows. I really love seeing the fellows come in and working with them longitudinally over the course of the year.
Part of what differentiates our program from other programs is the endless opportunities that are offered, not only just through our sports faculty, but also the complete faculty here at Brigham and Women's, as well as MGH partners at our sports center in Foxborough.
The city of Boston is obviously a wonderful historical city with just about everything you ever would want or need here.
Boston's great. I really like hiking and biking a lot, and there's a lot of opportunities for that in the area.
I just really enjoy getting a feel for the city. It's such a beautiful city along the Charles River, going for a run on the weekend, enjoying the wonderful food that it has to offer, and it's just so much fun. I wish I had more than 1 year to explore New England.
Living in Boston has been great. We spend the weekends strolling through the park and going to great restaurants. There's been some wonderful museums we've been to.
Harvard and the Brigham provide an unparalleled education and training experience. We look forward to meeting you and seeing you here.